It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Our first guest today, Dr. Neil Kaneshiro, a pediatrician, discussing the importance of wellness checks for kids during this COVID-19 era. You know, Shannon, I've heard of people saying, well, I called the doctor. They said, well, maybe you might have COVID, so we can't see you in person. We'll do a telemedicine thing, a checkup with you. But with your children, a lot of times, you need answers that can only really be provided by having them see the doctor. So Dr. Kaneshiro is going to talk about the ways to do that.
Absolutely. I mean, it's so important that children particularly continue with those wellness checks that are periodically scheduled, and it's important to keep those scheduled and keep that process and engagement with your pediatrician. Wellness checks are so important in our young people.
All right, we're going to talk with Dr. Kaneshiro about exactly that. Here are Dr. Neil Kaneshiro and Shannon O'Kelly talking about wellness checks for those kiddos during this COVID-19 period.
Dr. Kaneshiro, welcome to Health Talk. How you doing?
I'm doing great this morning. Thank you.
Thanks for joining us. Hey, you're a pediatrician with Woodinville Pediatrics. Before we get into the topic today, we want to talk about the need for wellness checks with our children and the concern with COVID. A lot of information has been in the media about some parents, some families not following up on wellness checks, not for the kids, but for the entire family. But before we get into that, tell us about your practice, your background, your history, and why pediatrics?
Well, I've been at Woodinville Pediatrics since about 1995. I did my residency at Seattle Children's and made a natural move to stay in the area. I love kids, and I've watched them, my patients grow up, and that's really the joy of my practice is taking care of them when they're sick and watching them go on to do great things from kids to adults.
So as you go through medical school, you look at all these different residency programs and opportunities. You can be a surgeon, you can be an oncologist. I mean, I'm always kind of interested to find out what spurred you on, what was your passion for pediatrics? It's a fantastic field, and it's hugely necessary right now.
And the one thing you notice when you're going through training is that in adult medicine, generally you're trying to slow that downhill slide, that inexorable, end. Where in pediatrics, the kids will get sick, but you can most often get them better, and they're back to doing what they're going to do for the rest of their lives. So I found that more uplifting for me.
Yeah, but uplifting, but it's a challenge because, children don't talk. In adult medicine, you can ask the patient for the history, and you do a history and physical, which is so important in medicine. In pediatrics, how do you read those, and how do you learn to do that? That's amazing.
Yes, well...
Go ahead.
Yeah, no, that's definitely a learned skill. It's is there a little bit of veterinary medicine training in there? Like your animals don't talk to you, but you still got to figure out what's going on. But we definitely utilize the parents and caregivers of the patients to give us the appropriate information to make the best decisions.
And you obviously enjoy your practice and enjoy what you do, but right now in COVID, tell us what Woodinville Pediatrics is doing to maintain safety, because I said earlier, a lot of families are concerned. There's this perception if I go to the doctor, I'm going to be exposed to the virus, and so people are pulling back, and it's so important that children particularly have wellness checks, vaccinations. There's this whole kind of health plan that they have that they need to go through. Tell us what's going on.
So the concern is real. COVID is out there, definitely, and actually it's increasing recently. So I understand parental concerns. However, all the pediatric practices that I know of are making all the right mitigation steps to minimize any kind of increased risk for patients who are coming into the office. Wellness checks are extremely important to monitor development, growth, as well as vaccinations, which we know by data. We have a central database that shows that the number of vaccines that have been given over the course of 2020 is between 20 and 30% less than normal years. And if we don't take care of that issue, we're going to have other epidemics besides COVID going on in our state.
Not only the fact that they backed up in the wellness checks, you just mentioned 30% reduction in vaccinations, but there's also challenges in the families today, and we can talk about that a little bit too. But kids not being in school, trying to learn virtually, trying to sit in front of a computer. I was a child of attention deficit and hyperactivity. I could have never sat in front of a computer. I could have never maintained a learning platform. It's got to be a huge challenge across the platform for families right now.
Parents are struggling. Some parents actually have to leave the house to go to work if they're essential workers. And so how do you manage that with your kids at home? it's very difficult. And we are, as part of our training, we're trying to help them manage through some of those issues.
We're going to come back with our conversation. Dr. Neil Kaneshiro, a pediatrician, talking about wellness checks for kids during COVID-19, and Shannon O'Kelly after this time out on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. IRG's Health Talk continues.
We are back with more Dr. Neil Kaneshiro and Shannon O'Kelly.
So some of the mitigation steps that we have taken, as well as many other practices that we know of, are to separate and reduce any exposure with obviously sick patients. So we screen them first on the phone when they call in. Anybody who's sick is triaged in some way, either to telehealth or to get a testing elsewhere before they come into the office. Mostly we're seeing actually checkups right now. I mean, we need to catch up on a lot of stuff that was missed earlier in the pandemic. And so we're separating patients by physically in the office. Only certain areas of the office, certain rooms are used for sick visits. All the rest are used for well visits, so they're relatively clean. And anybody who's obviously sick is told not to come in, or if the parents are sick, we ask them to reschedule when they're better.
Yeah, good stuff. And, it's real. You mentioned this. The virus is real. We all appreciate that. Is there any truth? What's your understanding, or do we have a clear understanding? Are children as susceptible? Obviously, adults are susceptible. We know as we get older, the elderly are really susceptible to this virus, COVID. What about kids? Can they get it? I don't know the real answer to that. I'm sure they can, but what is the answer to that?
Yeah, kids can get COVID just as easily as adults. I think fortunately what we have seen is that although there is a small chance that kids can get really sick with this COVID virus, most kids who get it will get over it and be fine. The issue really in our minds is that kids who get sick are vectors, and they can spread it to older adults. And older adults we know can get it and get really sick with it. And, they're much higher risk for death and morbidity from the virus. So we're trying to prevent the epidemic from progressing. And so that's part of why we're trying to keep everybody safe, not necessarily only for the kids' sake, but also for the kids and whoever their contacts are.
Yeah, as we wrap up here, I just want to kind of go over kind of a pathway here. Personally, as a pediatrician, is there anything that you're concerned about as far as wellness checks go? Let's say you had one vaccination, you need a booster. If you wait too long, tell us about kind of continuum.
Yeah, so reduced vaccination, missed vaccinations are a risk for reduced protection. So you're not going to get the protection you need if you don't complete the schedule. The wellness checks and the vaccines are critically important for kids for reducing disease in them as well as the population, because they can spread those diseases to adults as well.
Dr. Kaneshiro, thank you so much for your time. Thank you for the information. As we wrap up, I think the message to the public is don't be afraid to go to the doctor. The doctors are working on safety just like everybody else, and don't miss these wellness checks for anybody in your household.
100% agree. Come in for your checks, come in, get your vaccines, keep your kids safe, and keep everybody healthy.
There you go. That's from the pediatrician himself. Thank you, Dr. Kaneshiro.
Dr. Neil Kaneshiro, they're talking about wellness checks during this COVID-19 era that we're going through, Shannon. Things seem to be, not getting better. And we want to make sure our kids are taken care of during this time. So it's important to keep those medical appointments and I guess to keep the schedule that you have with your children, despite the fact that we're going through this right now.
Absolutely, Tom. It's not just medical checks, which are very important, from vaccinations and just wellness checkups and make sure things are going well for your children. But, in today's world, our kids are really struggling from a standpoint of mental. You hear it and you see it. They're not socially connected. They're not doing sports. So sometimes just going in and talking to a pediatrician and letting the pediatrician help. It's so important that we're talking right now with each other, our doctors. The world is just so different right now.
You're absolutely right. Thanks to Dr. Kaneshiro. Our next guest coming up next on KOMO.